This conference will now be recorded.
Okay. So today's topic is poliomyelitis. Poliomyelitis is a viral disease which may affect the spinal cord, causing muscle weakness and paralysis. The word polio means gray color, that is gray matter of the spinal cord, and myelin means is the covering around the bone marrow, that is indicating bone spinal cord, and are derived from Greek words. Poliomyelitis is a disease of the anterior horn cells of the spinal cord and brainstem caused by poliovirus. Poliomyelitis literally meaning gray spinal cord inflammation, that is an inflammation due to virus of gray matter of the spinal cord, that is called poliomyelitis. It is a viral infection. Virus localized in the anterior horn cells of the spinal cord and certain brainstem motor nuclei. It is contagious. Okay, usually spreads from person to person, only harmful to humans. The virus enters the body through the mouth, usually from hands contaminated of an infected person. There are three types of poliomyelitis, that is spinal poliomyelitis, bulbar poliomyelitis, and bulbospinal poliomyelitis. What is bulbar? What is bulbar? Can someone of you say what is bulbar? Sangeeta? Sai Priya?
Medulla, sir.
Medulla oblongata. Yeah. Okay. So bulbar is medulla oblongata. Disease is more common in the summer bar rainy season. It has two peaks and mainly rainy season. It is primarily an intestinal infection. Okay, that is usually spread by water and food, contaminated food. It is primarily an intestinal infection that causes paralysis in less than 1% of the cases. So historical background, if you say, it is first described by Michael Underwood in 1789. Initially, it was thought to be due to trauma, and later it is named as Heen-Maiden disease due to the work done by Jacob Heen and Carl Oscar Maiden. Later called infantile paralysis because it is having predisposition to children. Okay, it is the third human disease targeted for eradication. So smallpox already eradicated, rinderpest eradicated. Now poliomyelitis is on its way for eradication. We have eliminated polio from India in 2000, I think 14 they have declared it, 2013-14. Following which now polio is eliminated from India, and it should be eradicated means eradicated. It should not be there on earth. That is called eradication. Smallpox and rinderpest eradicated. Poliomyelitis is the third disease ready for eradication. Dracunculosis, yes, malaria, all these are to be eliminated and eradicated from our earth. So this is the history, but what it's happened is in immune individuals, immunoglobulin A antibodies against poliovirus are present in tonsils and gastrointestinal tract. So if you give oral polio vaccine, they develop immunoglobulin A antibodies which will be present on tonsils and gastrointestinal tract, and they will be able to block virus replication. Understood? That is why we are giving vaccination to the children. Immunoglobulin G and immunoglobulin M antibodies against poliovirus can prevent the spread of the virus to motor neurons of the central nervous system. Okay, what it will happen if it replicates, it will again enter into the motor neurons of the CNS. Infection or vaccination with one serotype of poliovirus does not provide immunity against the other serotype. That is why we are giving against three serotypes. From 2016, I think we have been changed. It has been changed to bivalent polio vaccine because type 3 has been completely type 2 has been completely eliminated. So we have been giving only 2 serotypes, 1 and 3. And full immunity requires exposure to each serotype. A rare condition with a similar presentation, non-polio virus poliomyelitis, may result from infection with non-polio enteroviruses. So in India, 40,000 cases of India polio reported in 1980s and until 2002. Uttar Pradesh alone accounted for 2/3 of the world's polio cases. Okay, no polio case reported since 2011. Definition: it is an acute viral infectious disease caused by enterovirus. It is a group of enteroviruses. The word poliomyelitis means inflammation of the spinal cord, which often targets the insulating material covering the nerve cell fibers, myelin. Greek word that is polios means gray matter of the brain and spinal cord. Myelos means spinal cord. So gray matter of the spinal cord. Route of infection is fecal-oral route. Epidemiology wise, in 2011 itself is the last 5 cases, and one is wild polio and four of vaccine associated paralytic polio has been reported, following which no other cases has been reported from India. Genus is enterovirus, species is poliovirus, structure is single stranded RNA with protein envelope. Like our SARS-CoV-2 virus, it is also a single stranded RNA. Enclosed in a protein capsid. Types: 3 types: oral poliovirus 1, 2, and 3. Differentiated by a type of capsid protein. Size is 30 nanometer in diameter with icosahedral symmetry. Poliovirus 1 is the most common encountered form and the one most commonly associated with paralysis is poliovirus 1, first one. So what is the resistance in feces for months at 4 degrees centigrade and years at -20 degrees? It is -20 degrees. Inactivated by heat and chlorination. Host range is natural infection occurs only in humans. Mode of transmission is fecal-oral route. In early stage of disease, through inhalation or entry through conjunctiva of droplets of respiratory secretions of the patients. Okay, so it is a very rare through inhalation route, but common is fecal-oral route. Period of communicability is 7 to 10 days before and after. It is not years, sorry, it is 7 to 10 days before and after the onset of symptoms. Age is most vulnerable from 6 months to 3 years. This is the age group which is most commonly affected. Seasonal, most common during rainy season. Peak season due from July to September, that is rainy season, flu season. Environmental source of infection is contaminated water and food, flies, overcrowding, and poor sanitation. Understood? CSC, mosquitoes, contaminated hands. Okay, feces. Age group commonly affected is infants and elderly, but usually we say in infants only, not elderly. Living with an infected person is also a risk factor. Compromised immune system, lack of immunization against polio, extreme stress or strenuous activity. Travel to an area that has experienced a polio outbreak also can cause. Enteroviruses. Poliovirus is an enterovirus type 1 to 3. Coxsackie virus, group A, group B, echovirus, and enterovirus type 68 to 71 are the commonest group of organisms, but poliomyelitis is caused by poliovirus type 1 to 1 and 1, 2, and 3. Life cycle of poliovirus is the causative agent of poliomyelitis is a human enterovirus and member of family of picornaviridae. Poliovirus is composed of RNA genome and a protein capsid. The genome is single-stranded positive sense RNA. It enters through mouth, that is fecal-oral transmission. In intestine, what happens? The virus starts replicating after attaching to a receptor in the intestine. Then infection begins. The poliovirus genome enters the intestinal cell. After entering the intestinal cell, the viral RNA takes over the cell and replicates RNA in the intestinal cell. Then it forms a new poliovirus particles. Then thousands of poliovirus bursts out of the cell and enters the bloodstream. Okay, this is called primary viremia. Understood? So portal of entry, local multiplication within the GIT, primary viremia, then leads to secondary viremia. They will get seeded into the spinal cord and brain, multiplies within the neuronal, that is anterior horn cells of the spinal cord, and the lesions are mostly in the anterior horn cells of the spinal cord, causing flaccid paralysis, and finally destroys them. See, we don't want to see any child like this. Okay. So what happens after bloodstream infection? It multiplies within the reticuloendothelial system, that is bone marrow, lymphoid tissue, tonsils, everywhere, and then leads to secondary viremia. From there, they will, after primary viremia, it leads to, it enters into this reticuloendothelial systems, bone marrow and lymph nodes and spleen everywhere, and then leads to secondary viremia. Bloodstream and directly from tonsils and IM injection, it will lead to carried to spinal cord and brain. It multiplies in neurons and degeneration of Nissel's bodies, chromatolysis occurs. Nuclear changes later follows, followed by degeneration, irreversible. It is not reversible, understood, irreversible damage. So if you see here, encephalitis involving brainstem, motor and premotor areas of the central cortex is also noted. Encephalitis, that we will call it as encephalitis. So if you say clinical features and types, in poliomyelitis virus infection is inapparent and apparent. Inapparent poliomyelitis infection, okay, it is 90 to 95% of the cases will not will not show symptoms. In 5 to 10% of the cases, they will show abortive polio, non-paralytic aseptic meningitis, paralytic poliomyelitis, and poliomyelitis. Understood? Abortive polio, non-paralytic aseptic meningitis, paralytic poliomyelitis, and polioencephalitis. Clinical features and types continued. The infection may occur in two forms. That we already said, inapparent or asymptomatic. 90 to 95% of the cases accounts for 95% of the total cases. Virus stays in the intestinal tract, then does not attack the nerves at that time. Virus is shed in the stool, so infected individuals still able to infect others. Apparent or symptomatic cases, 5 to 10% of the total cases, it is called abortive polio, or non-paralytic asymptomatic meningitis is a different mode of manifestation. Paralytic poliomyelitis is another clinical feature, and polioencephalitis. Abortive polio, 4 to 8% of infections does not lead to paralysis, leads to minor illness. Low grade fever, sore throat, vomiting, abdominal pain, loss of appetite, malaise, and recovery is complete. Most recover in less than 1 week, no residual paralysis. Non-paralytic aseptic meningitis occurs in 1 to 2% of the polio infections, leading to headache, nausea, vomiting, pain and stiffness of the neck, back and legs. Complete recovery after 2 to 10 days of the onset of symptoms. This is tripod sign. You in practicals also they may ask you what is tripod sign. Tripod sign is the child with positive tripod sign assuming a tripod position, that is knees flexed, hips flexed, the back arched lordotically. Okay, back arched lordotically means like this, curved, see curve backwards. The neck is extended, okay, and the arms brought back in a plane posterior to the pelvis to support the thorax. That is called tripod sign, because in the anterior horn cells, when they start degenerating due to this virus, they will start continuously discharging. So what happens? Paraspinal muscles and all will start contracting and stiffly, and so that lordotic posture of the spine, and it will not allow hip and knees to extend. That is why this tripod sign will occur. And here extensor muscles of neck also will be stiff. So he is having extended neck, saying up. Kiss the knee test is another sign. Method. Knees kept down. Child asked to kiss his knees. What we will observe? He cannot do the maneuver due to stiffness of the spine. May drop the knees sharply to do that. Okay. So head drop sign. When child is held with the shoulders and head lags and behind limply. Okay. Neck rigidity. In uncooperative child, place the child beyond the edge of the table, and observation is true involuntary neck rigidity persists and voluntary stiffening of the muscle disappears. Okay. Paralytic poliomyelitis, that is 0.5 to 1% of the total cases. And it has two phases, that is minor, similar to abortive polio, and major phase, that is muscles pain, spasm of the muscles, and return of fever. Uh, Followed by rapid onset of flaccid paralysis, complete within 72 hours. It is of three types: spinal paralytic poliomyelitis, bulbar poliomyelitis, and bulbospinal poliomyelitis. Spinal paralytic poliomyelitis attacks motor neurons in the spinal cord and causes paralysis in arms and legs and breathing problems. Most commonly, 79 to 80% of the cases results from lower motor neuron lesion of the anterior horn cell of spinal cord, affects muscles of legs, arms, and trunk. Severe cases have quadriplegia, paralysis of trunk, abdominal, and thoracic muscles. Paralysis, asymmetrical, legs more than arms, descending type of paralysis. Okay, and children less than 5 years most likely to become paralyzed in one leg. Adults are more commonly paralyzed in both the arms and legs. Muscles will be floppy. Reflexes diminished. Deep tendon reflexes lost before onset of paralysis. Sensation is normal because it is a disease of motor neurons, not the sensory neurons. So sensations will be normal. Understood? Bulbar poliomyelitis affects neurons responsible for sight, vision, taste, swallowing, and breathing. It accounts for 2% of the paralytic polio because brainstem is affected, swallowing and breathing will be affected. Life threatening because once the patient stops breathing, then that's the end of the matter. Virus attacks motor neurons in the brainstem, affects cranial nerve function. Cranial nerve lesion mainly vagus. Bradycardia can occur if vagus is affected, and primarily inhibits ability to breathe, speak, and swallow. Facial asymmetry can be present. Symptoms include nasal twang and hoarseness of voice, nasal regurgitation of feeds, dyspnea, that is labored breathing, dysphagia, difficulty or discomfort in swallowing, child refuses to feed, child will have secretions accumulating in the pharynx and may lead to aspiration, involvement of respiratory center leading to shallow irregular respiration, vasomotor center BP rises then falls, pulse rapid, weak thready pulse, skin dusky and mottled, restless and confused, and finally comatose. Okay, once vasomotor tone is lost, here libido reticularis, this we will call it as lacy pattern on the legs. Bulbospinal poliomyelitis accounts for 19% of total paralytic cases. Affects extremities and cranial nerves, leads to severe respiratory involvement. Okay, because bulbospinal, both brainstem and spinal cord is affected, may have severe respiratory involvement, and majority of them will die. Combination of spinal paralytic and bulbo polio. Polioencephalitis means brain, occurs in rare cases, causes inflammation of gray matter of the brain. Autonomic dysfunction is common and it has a high mortality. Signs and symptoms: agitation, confusion, stuporous, comatose, finally delirium, and coma is the end stage. Disorientation, tremors, convulsions can occur. Paralysis of upper motor neuron can occur. Residual paralysis, acute phase of illness lasts for 0 to 4 weeks, around 1 month. Recovery is variable. At 60 days, mild to severe residual paralysis definitely will be there. Maximum recovery up to first 6 months is expected. Beyond that, we cannot. Slow recovery up to 2 years can be there. After 2 years, post polio residual paralysis will persist for lifetime. Diagnosis is by history of fever, pain in the muscles. Okay, may have a contaminated, may after eating contaminated this one food or water, and then have So vomiting, headache, delirium, all these things can have, and muscle spasms and pains, and tripod sign, all will be there in clinical examination, and stool examination, CSF examination, and serological tests. So stool examination, what we will do, laboratory diagnosis of polio is confirmed by isolation of the virus by cultures from stool or throat swab or CSF, but these are rare, only stool is being sent. In our AFP surveillance also, acute flaccid paralysis surveillance program by WHO also, will be sending motion only, stool only. If an infected person, the virus is most likely to be cultured in stool cultures only. Collection of stool sample, 2 samples should be collected 24 hours apart. Within 14 days of onset of paralysis, you better to collect 8 to 10 grams or thumb size of stool should be collected. Collection in a clean wide mouth bottle and plastic or glass with screw cap. Sample should be stored below 8 degrees centigrade. No desiccation or leakage still received at WHO accredited lab. Okay. If paralysis detected after 2 weeks of sample collection, sample can be taken up to 60 days also after the onset of paralysis. The contact sampling done. This is done when child has died without adequate stool sampling. 5 children in close contact with that child will get stool sample from them. Understood? CSF examination. Infection with poliovirus may cause an increased number of WBC and mildly elevated protein level in the CSF. The appearance will be clear but slightly turbid. Cells 0 to 5 cells, most probably polymorphonuclear leukocytes, that is less than 2. Leukocytosis, mainly lymphocytes will be there. 3 proteins usually should be less than 45. Here it will be slight normal bar slightly raised 100 to 300 milligram per deciliter. Glucose should be more than 60% of serum glucose. It will be similar in virus infection. Serological tests, acute and convalescent serum samples may be tested for rise in antibody titers. Antibody is antibody to poliovirus, but the report can be difficult to interpret as it may, in many cases, the rise in titers may occur prior to paralysis. 3 types of antibodies we will be checking for, that is neutralizing antibody, that is immunoglobulin G, antibody to C antigen, that is immunoglobulin M, and anti-D antibodies. Complement fixation test, which detects immunoglobulin M and anti-D antibodies, identifies exposure to poliovirus, not for type specific diagnosis. We have different types, but not type specific diagnosis. It is polio or not, it will say. Less often employed. A differential diagnosis for polio is Guillain-Barré syndrome and transverse myelitis. Others can be traumatic neuritis, meningitis, encephalitis, and toxin-induced diphtheria and botulism. Treatment will be symptomatic and supportive care. The goal of the treatment is to control symptoms while the infection runs its course, as there is no specific treatment. Andukune only vaccine is only preventive measure. There is no treatment for polio virus. So wherever possible, whenever during you come across less than 5-year-old children, and there is a pulse polio program happening, that is usually in January and February, the pulse polio may be, or the government may be organizing pulse polio regularly. So at that time you should say, irrespective of the vaccine doses, these are additional doses. Ask every parent to get a polio vaccine for their child. Okay, they're less than 5 years of age. Definitely we should give 2 drops is the dose. The goal of the treatment is to control symptoms only. Okay, not much. So treatments may include hospitalization. Hospitalization may be required for those individuals who develop paralytic poliomyelitis. If the respiratory system is involved, then long-term mechanical ventilation is also required on ventilator. So catheterization of the distended bladder, because spinal cord is affected, bladder abnormalities can start happening, and we have to catheterize the bladder. Antibiotic for urinary tract infection, moist heat to reduce the pain and muscle spasm. Ante kada, epudaina baga muscle spasm vaste hot fermentation we will do. That is one thing. And painkiller to reduce the muscle spasm, headache. Physical therapy, physiotherapy exercises, braces or corrective shoes, or orthopedic surgery to help recover muscle and strength and function. Bed rest essential during acute phase. Physical activity and trauma increases risk of paralytic polio. Posture to be changed every 2 to 3 hours. Child to be placed on stomach for short period each day to prevent pneumonia. Optimum position for limbs: hip slight flexion, knee 5 degrees flexion, foot 90 degrees flexion and support against the sole. Okay, should be done. This is the optimum position for the poliomyelitis limbs. Okay, pain relief. For pain relief, sister Kenneth treatment, hot moist packs applied to the muscles to relieve pain and spasm, and analgesics should be given. Physiotherapy, joints and paralyzed muscles should be passively moved for a range of, through full range for 10 minutes. That is 2 to 3 times a day we have to do with two benefits. Prevents deformities and contractures. Okay, we don't want contractures, so we have to prevent deformities. Promote development of muscles power in paralyzed muscles. So physiotherapy is important. So joints and paralyzed muscles moved passively through full range. Okay, team approach is essential. Diet, nutritious and balanced diet, wholesome diet is required. Okay, tracheostomy may be required and respiratory failure assisted ventilation may be required. Indications for hospitalization: paralysis of upper limbs for less than 3 days duration, progression of paralysis, bulbar involvement, that is brainstem involvement, respiratory distress, marked drowsiness and complications. Rehabilitation through physical therapy, that is physiotherapy, and orthosis means braces and all these things. Static joint instability when controlled by orthosis, and dynamic in joint instability by cannot be controlled. It is a result in a fixed deformity. Special supports for deformed knees. Okay, here loose posterior strap, tight posterior strap to straighten the leg, all these things. See how pathetic it is for a child to have this poliomyelitis and having these straps. Poor child, how nice he is. Okay, physiotherapy. Emotionally and psychologically also parents will be very much affected. Occupational therapy provides purposeful activities or interventions in order to promote function, health and wellness and to prevent further injury or disability. The goal is to assist survivors in achieving their maximum level of independence. Means the child should be doing his day-to-day activities like eating food or going to toilet, all these things if we can do without any assistance, that is the maximum power we can attain in all the muscles. To be seen by an occupational therapist, and he should be employed in such jobs where not much heavy work will be there. Recreational therapy. Patients may attend leisure activities to reduce the stress and learn how to get involved in group activities. Speech therapy. Whenever speech is affected, speech therapy and therapists should be available for doing that. What are the complications of poliomyelitis? Myocarditis, hypertension, pulmonary edema, pneumonia, urinary tract infections, compressive neuropathy, scoliosis, osteoporosis, bone fractures, skeletal deformities, and equinus foot. So management already we have done, we have told supportive care. Prognosis: non-paralytic cases, complete recovery occurs. Paralytic polio, permanent weakness in 2/3 of the cases, and worse in older children, sudden onset of illness with high fever. Post-polio syndrome observed in patients who have polio during their childhood, having complete recovery, but may develop signs of polio in later stage. That is very bad. After about affects about 25 to 50% of the polio survivors, more common in females. So common signs and symptoms: progressive muscle or joint weakness and pain, generalized fatigue and exhaustion after minimal activity, muscle atrophy, breathing or swallowing problems, sleep related breathing disorders such as sleep apnea, decreased tolerance of cold temperatures, cognitive problems such as concentration, memory difficulty, depression or mood swings. Prevention: the best preventive measure for poliomyelitis is ensuring hygiene and good sanitation practices. Polio vaccination. Polio vaccine covering all 3 serotypes, no only 2. Continued. Global polio eradication initiative started in 1988 and polio cases decreased by over 99% since 1988. Understood. In 2010, only 4 countries in the world remain polio endemic. That is Afghanistan, India, Nigeria, and elimination. In 2014, it is declared India is declared polio free. Core strategies for global polio eradication initiative. High infant immunization cover. We have to give infant coverage to almost all the infants. Supplementary doses of OPV in pulse polio immunization programs. AFP surveillance, acute flaccid paralysis surveillance should be done at outbreaks. Targeted mop-up campaigns means wherever once polio virus transmission started, we should be doing mop-up campaigns around that area. So vaccine are two types: inactivated killed polio vaccine (IPV) and live attenuated weakened, that is oral polio vaccine. Inactivated polio vaccine, it is inactivated, so it cannot replicate and cannot be shed in the stool of the vaccinated person. It cannot cause vaccine associated paralysis and is safe to use in immune deficient children or in household contacts of immune deficient patient. Disadvantage: requires injection, more expensive, produces less local gastrointestinal immunity. Recipients could become infected with wild polio viruses. Oral polio vaccine, it is very easier to administer, less expensive, produces excellent intestinal immunity, which helps prevent infection with wild virus, may cause vaccine associated paralytic polio. Understood. Guide on immunization. If you see, rationale for IPV: lowers the risk of re-emergence of type 2 wild poliovirus and vaccine-derived poliovirus, facilitates control and interruption of reintroduction of type 2 poliovirus in conjunction with targeted use of monovalent OPV. Okay, so if you use IPV, we can reduce incidence of type 2 poliovirus. Type of vaccine: inactivated vaccine with types 1, 2, and 3 antigens. Route of administration: intramuscular or subcutaneous route. Immunization schedule: it will be given at IPV will be given at 6, 10, and 14 weeks. Understood. Volume dose is 0.5 ml. Storage 2 to 8 degrees. We should not freeze this vaccine IPV. Only OPV should be given in kept in deep freezer. Understood. Oral polio vaccine, route of administration is oral, site is mouth. Number of doses is 3 doses. Age at first dose is 6 weeks after birth. Minimum interval between the doses is 4 weeks. Dosage is 2 drops. Storage is -15 to -25 degrees. Polio vaccine adverse reactions: rare local reaction. No reactions to IPV have been documented. Paralytic polio OPV. Polio vaccine contraindication and precautions: severe allergic reaction to a vaccine component or following a prior dose of vaccine, moderate or severe acute illness. Vaccine associated polio, paralytic polio. Mutation of the vaccine inside the body may cause loss of this attenuation and lead to paralytic polio. That you can remember, that is more than enough. Polio and ITS and its prevention in India. India was one of the 4 countries with wild poliovirus in 2010, but now India has been removed from that list. Polio-free country from Jan 2014. Understood. Celebrities engaged in for this is Amitabh Bachchan. If you see, 2 drops for life, that is do born zindagi ke liye. Meaning this meant 2 drops that had the power to decide whether a child will walk, limp, or die. Birth 0 dose, first dose 6 weeks, second dose 10 weeks, 14 weeks third dose, and 16 to 24 weeks, 24 months, sorry, OPV 4th dose. 2 drops of OPV should be used. Pulse polio immunization. The supplementary immunization activities in India launched in 1995. Irrespective of immunization status, in December and January, peak transmission is there usually. So at that time, we are giving pulse polio immunization. Understood. This is called vaccine vial monitor. This is because it helps us predicting whether the vaccine has been transported safely within all the cold storage. If it is black colored, should not use. It is similar color to outside ring, should not use. Only this you should use. Okay, this type and this type you can use. This type you should not use at all. Understood. It is completely damaged. Prognosis. The outlook depends on the form of the disease and the body area affected. Okay. Brain or spinal cord involvement is a medical emergency. Remember, because of respiratory problems. Disability is more common than death. Understood? Okay. Understood? Do you have any doubts?